Namaste to all. Myself, Dr. Muttappa Total, consultant and associate professor at the Esteem College of Ayurveda and Hospital Hassan, want to share you a case report on traumatic cervical myelopathy through Ayurveda. This is introduction of cervical myelopathy. Myelopathy is an injury to the spinal cord due to severe compression that may result from congenital stenosis, degenerative disease, disc herniation, trauma. Cervical myelopathy is the most common form of myelopathy. Every year around the world, 2.5 lakhs to 5 lakhs people suffer from spinal cord injuries. Here is a case of 64 years male patient farmer who was admitted on 23 March 2019 in our hospital. This is a history, that is the date of trauma, road traveling accident RTA on 25 February 2019 at 8 am, fall from bike, unconscious approximately half an hour, initially treated at United Hospital 22 days, next SP Institute of Neurosciences for 6 days. He is a known case of diabetes mellitus for 1 year, metformin and glimepiride he is taking. Known case of hypertension since 2 months, Nevilong 5 mg at night he is taking. Coming to the now, what are the status or what are the complaints of the patient? Number one is quadriplegia, that is right sided more weakness than the left side since 1 month. Incontinence of bowel and bladder since 1 month. Giddiness on erect posture 1 day. Heaviness in the limbs, lower limbs 7 days. These are some videos which we on the first day we evaluated. Just some of those I am going to show you here. First video will tell the strength of the legs, that is right side 1 out of 5, left side 2 out of 5. Yes, this is almost 2. He is not able to do 3 because full range of movement is not possible. That's why we considered only 2. In second video, the power or the muscle strength of hands, that is strength in hands, right side 1 by 5, left side 3 by 5. Where in left upper limb he is good, he is going to do almost full range of movement. Next, this third video is showing the postural giddiness. When we ask the patients to sit for 3 to 5 seconds, he feels the giddiness. You can observe it. Yes, he is falling to left. And he shows that signal that he is getting the giddiness. So in below table, the different areas of upper limb, lower limb, we assess the muscle strength. Those are given. That is right side upper limb proximal 1, right side upper limb distal 3, right side lower limb proximal 1, right side lower limb distal 2, and right side hand grip is 1, and left side upper limb proximal is 3, left side upper limb distal is 3, left side lower limb proximal was 2, left side lower limb distal was 2, and left side hand grip was 2. The patient, what the investigation he had, number one is MRI of cervical spine on 25 to 2019 reveals compressive myelopathy and canal stenosis at C5 C6 level. One more, he had CT scan of cervical spine on 19/3/2019 reveals cord compression at C5 C6, severe spondylotic changes at C4 5, C5 6, C6 7 level, disc protrusion at C5 C6, fracture of left inferior articulating process of C5. So what we assessed from Ayurvedic side, the Savida Pariksha, out of them, Samvahana compactness was Avara, placid, that we consider it as hypotonic, that's why we consider it as Avara. Ahara Sakti was Avara, Vaya was Ruddha. And the Dosha Dusha, etc. In Dusha, Asti Majja, Snayu, Mala, Mutra was vitiated, involved, Bala, Avara, Agni was reduced. So coming to the pathology, what we understood in this patient. So coming to the etiology, Charak Chikitsa 28th chapter, Vata Vyadhi chapter, he told a list of Vata Vyadhi Karanas, Nidanas. So out of them, so we found in this patient is this, that is Marmaghatat Gajostra Ashwa Sigrayana Apatam Sarat. In this, 2 points we get in this patient, that is Marmaghata is the cervical spine injury, that's the Marmas, and Yana Apatamsara. So fall. First is Yana Apatamsara, fall from the bike, Yana. Number two is spine, cervical spine injury, that is Marmaghata. That these two reasons means Karanas, etiological factors we found in this patient. Coming to the features of this disease, that is Hatvaikam Marudha Paksham Dakshinam Mamaveva Kurya Chesta Nivrittim He Ruja Vakstamba Mevacha. So here we have to concentrate. Here is Chesta Nivritti. So in this patient, the loss of strength is there in all the limbs. So some patients will present you with Ruja. In this patient also later on he presented with Ruja. Some patient will present Vakstamba. So in this patient we got his Chesta Nivritti in the initial stage. Third point, that is pathology, according to Charaka Chikitsa 28th chapter, we have is Vayor Dadukshayat Kopo Margasya Avaranena cha. So there will be Vataruddhi by two reasons in pathological events. That is Dadukshaya, there will be Vataruddhi. Number two is Marga Avarana will cause again Vataruddhi. So here one more reason the Vata get aggravated in this patient is Pitta Kapha are obstructing the Vata channel ಅಥವಾ vata root. So number fourth point, once again in Asti Majjagata Vata, which is told in Charaka Chikitsa 28th chapter, the quotation goes like this: that is Bedo Asti Parvanam Sandishulam Mamsa Palaksayaha Aswapnaha Satataruk Cha Majjasti Kupite Anile. So in this, what I want to concentrate is Mamsa Palakshaya. Palakshaya is the thing what we can get in this patient, that is the weakness in the body. Number fifth pathology is Nayagata Vata, Charaka Chikitsa 28th chapter. He told that Bahyabhyantar Ayamam Kallim Kubjatvam Mevacha Sarvanga Ekanga Rogamscha Kuryat Snayagato Anilaha. So in Snayagata Vata, the Bahya Abhyantarayama, Kalli, Kubjatva, Sarvanga Roga, Ekanga Roga, these are the presentations, manifestations. So in this patient also we got Sarvanga Avastha, Sarvanga Roga. So on these basis, we diagnose this patient according to Ayurveda as Sarvanga Roga, that is Marma Abhigataja Sarvanga Roga. In modern traumatic cervical myelopathy, stage is Pitta Kapha Avruta stage in Ayurveda. So treatments what we adopted is, number one is Sarvanga Roga, general line of treatment which is adopted for duration is 3 to 4 months according to Shishro Chikitsa 5th chapter, that is Mahavata Vyadhi chapter. The quotation is Tatra Prageva Sneha Svedopapannam Mruduna Shodhanena Sanshotya Anuvasya Astapya Cha Evam Matandritah Trin Chatro Vamasan Kriyapatam Upesheveta. He tells here, this is a big quotation we have, I just made some simpler understandings here. He told to adopt this Chikitsa Sutra for 3 to 4 months continuously, Atandritaha, without gap. That is, for example, Snehana, Svedana, Shodhana, that is Mrudu Shodhana, Astapana, Anvasana, Basti, etc. So this should be given continuously for 3 to 4 months if the patient is able, athwa yogya for each in subsequent stages. So otherwise, it will take more time. So in this patient, same thing happened. The patient was, as it is not able to have these all treatments at once, means subsequently. So we given it took more time. So this is one reference we got, what we adopted. Number two is Asti Majjagata Vata Chikitsa according to Charaka Chikitsa 28th chapter, that is बाह्याभ्यन्तरतः स्नेहैर अस्ति मज्जागतं जयेत. So in asti majjagata avastha we have to go for snehana, that is bahya abhyantara. So what we adopted here is abhyanga and anvasana basti treatments. So number third is what all treatments we adopted in a precise way. Along with oral medicines, we adopted the procedures like Udvartana, dry powder massage to remove kapha dosha obstruction avarana, Abhyanga oil massage to pacify V-sated vata dosha, Svedana sedation to pacify kapha or and vata dosha, Deepana stimulation of digestive fire to normalize tissue formation. Vatanulomana formulations to normalize bowel and bladder functions. Rasayana rejuvenative and nutritive medications. Basti transrectal administration of drugs, which is best for Madhyama Roga and Vata. Asti Majjal Chikitsa normalization of bone and nervous tissue formation. So coming to the treatment timeline, so what we exactly adopted, what we assessed first, and what was the aim, and what is the duration, and what is the condition of the patient, and what was the result. So these are the different columns. What will these will tell you the different understandings what we planned in this patient. Number one is the course, that is first IP inpatient. So admission. So it was admitted for duration is 26 days. So condition was reduced strength in all limbs, incontinence of bowel and bladder, giddiness on erect posture, heaviness in the legs, unable to sit for more than 3 to 5 minutes. So any of the treatment was Pitta Shamana, Kapha Shamana, Avarana Hara, Vata Shamana, Asti Majja Chikitsa, Rasayana. So result was incontinence of bowel bladder reduced after 26 days, giddiness reduced, heaviness reduced, strength in the limbs improved, able to sit and stand with support for longer period. So these are the plans what we adopted in this patient, and exact what treatment we did during these 26 days, where the treatment is treated pitta first. What we have pitta kapha avruta avastha of sarvanga roga we diagnosed, that is pitta kapha avruta. That's why we have a reference from Charaka Chikitsa 28th chapter, that is Sanskruste kapha pittabhyam pitta madho vinirjayet. So if kapha and pitta both are our for the vata dosha, then first we have to treat pitta madhav vinirjayet. So for that purpose we adopted pitta chikitsa first, that is kamaduga mukta 1 TID we adopted, cerebella capsule we adopted for pitta samanartha, and nadi kashaya 100 ml OD after food we adopted for nadi shodhanartha, that is spinal cord tablet. Anuloma DS we adopted as patient was telling the stool was somewhat hard, incontinuous, but is the hard was there. Physiotherapy, passive and active exercise we did. So after 10 days of this treatment, so patient improved in this regard, that is postural giddiness reduced, control on bowel and bladder was observed. So then we shifted to kapha and vata chikitsa, that is we shifted to lasuna 2 grams morning before food with warm milk. That the intention was Kafara, Rasayana, Sarva, Avaranara, according to Ashtanga Hridaya, Uttaratantra 29th chapter. So Dhanantaram tablet 1 TID as Deepana and Vatanamana before food we adopted. Sthanika Udvartana to legs, hands followed by warm water bath as Kapashamana. So the reference is from Ashtanga Hridaya Sutrasthana, that is Udvartanam Kapaharam Medasaha Pravilayanam Sthirikaranam Manganam Tvak Prasadakaram Param. So here is Kafara. Number 2 is Sthirikaranam Manganam. So there will be stability athva the looseness in the joints will be re-established, will be reduced. There will be sthiratva athva stability will be achieved. So these are the two things what we expected with this treatment. Number 4th was Anuvasana Basti Brahat Saindavadi Taila 40 ml as Kapha Vatahara Madhyama Roga Marka. The reference what we have from Charaka is Tata Sneham Mrudo Koste Na Tishtati Anilamayaha. When we give Snehana, with that Snehana, if Kosta got Mrudutva, and that Mrudu Kosta will not allow the Vata Vyadhi to stay in the Kosta. That is understanding. Number 2 is for Madhyama Roga Basti is the good choice of treatment. And Bharat Saindhavayatara was selected because of Kapha and Vata involved. It is the reference from Amavata Adhikara from Baisi Ratnavali or Chakrapani Datta Chakradatta textbook. Number fifth treatment what we followed is physiotherapy, passive and active exercises we followed for 10 days. These 1 to 5 adapted for 10 days. So heaviness reduced 80 to 90%. Pain in the shoulder for 1 to 2 minutes occasionally observed since 2 days. So in the recent 2 days he started to have pain in shoulders. Then we shifted to, as pain was observed and heaviness was reduced, we thought of the vata is predominantly now active अथवा the kevala vata avastha came. Now we shifted to vata alone chikitsa, that is selecting lasuna 2 grams morning before with warm milk as rasayana and vatara avaranara. Dhanotram tablet 1 TID before food, Sthanika Abhyanga with Ksiravala Taila and Sestika Shali Pindasveda SSPS Vatsaman and Balya. Physiotherapy we continued. These 1 to 4 were continued for 6 days. So these 10, 6, total 26 days we given in IP, first admission. And next we discharged the patient with the following medicines for 21 days. So another treatment in these 21 days was Vatashamana, Rasayana, treatments adapted is Abhyanga, Lasuna, Sirabala. Result was able to sit and stand without support for few seconds. After 21 days, he was able to sit and stand without support for few seconds. So the treatments what exactly we adopted were Lasuna 2 grams morning before food with warm milk as asayana, Cerebella capsule 2 BD after food as Balla, Anloma DS 1 HS as Vatanlomana, Cerebella Taila Sthanika Benga to legs and hands daily with warm water bath, then continued physiotherapy, that is passive and active exercises. Then we made the patients to get admit in 12th May 2019 to 2/6/2019, that is 21 days, second admission, second time admission, that is second course of IP level treatment. So the condition observed was numbness in the legs 2 days, neck pain since 1 day along with the reduced strength in the limbs. So aim of the treatment was Kapha Samana, Vatsamana, Asti Maja Chikitsa, Rasayana Balya. Treatments adapted were Deepana, Vatanlomana, Udvarthana, Griva Pichu, Basti, Abhyanga, SSPS, physiotherapy. So result was after 21 days of this treatment, numbness reduced, neck pain reduced, able to walk without support 12 to 15 steps. There is a video, but I will show it at last all these things at once. So the treatment what exactly we adapted within these 21 days where Nadi Kashaya 100 ml OD as Nadi Shodhanatta, Dhanodran tablet 1 TID before food, Anloma DS 1 HS after food, Griva Pichu, Nirgunditaila OD as pain relief, as neck pain was observed in this patient, Sthanika Udvartana to legs and hands followed by Nadi Sweda 7 days. This was the first, and then we shifted to Anvasana Basti, Broad Saindavadi Taila 40 ml 7 days, Sthanika Apenga with Kottam Chukadi Taila to legs and hands and Nadi Sweda 7 days. So these are all Kapha Vata Hara in action. So now after 14 days of this treatment, patient got improved in numbness reduced 95%, neck pain was reduced, no neck pain. Then we shifted to Vata, there is Dhanvantram tablet 1 TID before food, Ashwagandha capsule 4 grams morning before food, Balya tablet Anloma DS 1 HS after food, Sthanika Abhyanga with Kirvadela and Shastikasali Pinda Sveda to legs and hands, and Vaspa Sveda. Physiotherapy, passive and active exercise we continued for, we given for 7 days. This is 14 and 7 days, 21 days we given second IP athwa admission treatment. So then we made the patients to discharged with oral medicines and some local applications for 150 days. The aim of this treatment was Vatasamana Rasayana. Treatments adopted in superficial is Abhyanga, Ashwagandha, Lasuna, physiotherapy. Result was able to walk 200 meters without support after 150 days. The treatments what we adopted in these 150 days were Dhanotram we adopted 1 TID before food, almost 15 minutes before ಅಥವಾ half an hour before food. Ashwagandha capsule 4 grams morning before food and lasuna 2 grams morning before food. Anuloma DS 1 HS, Kshiravala Taila, Stanika Abhyanga to legs and hands daily, physiotherapy, passive and active exercises. So review after 45 days. So on every 45 days we reviewed and we asked the patients with the telephone. We asked the patient to change the medicine according to that. For example, first 45 days we adopted ashwagandha capsule 45 days in the 4 grams morning before food with warm milk, that is the one mandala or one rasayana mandala days, and next 7 days we given gap and we shifted to lasuna 2 grams for next 45 days, and next for after that 45 days 7 days gap we given with no medicine of lasuna or ashwagandha, and next once again for next 45 days we given ashwagandha. So like this total 150 days of treatment we adopted in the form of rasayanas with ashwagandha and lasuna alternating. So we after 150 days we ask the patients to get admit for third course of treatment, that is for 11 days. So aim of the treatment in this duration was Vatsamana Asthimajja Chikitsa Rasayana treatment Vatanlomana Basti. Here we planned for Kala Basti. Niruva and Astapana Niruva and Anvasana both we planned here, and physiotherapy. So result was able to walk half kilometer to 1 kilometer, do daily routines after 11 days of treatments. So treatments what we adopted in 11 days of third course of IP level treatment where Dhanodra tablet 1 TID before food, Ashwagandha 4 grams morning before food with more milk, Sarvanga Abhyanga with Kshiravala Taila and Baspasveda, Basti schedule, that is Kala Basti, Anvasana Basti, KV Taila, Kshiravalla Taila 60 ml, Niro Basti, Erana Muladi 400 ml. So this is a table was showing the you know format of adaptation of Kala Basti. So first day we started with Anvasana, next 6 days Niruha on the same day and Anvasana also same day for consecutive 6 days. Next last 2 Anvasanas for 15 Anvasana we given, total number of 15 Basti we plan, we given. Next we continued physiotherapy, active and passive exercises. This was adapted for 9 days. After that, so there is the improvement as result was able to walk half to 1 kilometer, do daily routines. So next second row, that is follow up. So we assess on 4 November to 2020, that is after 12 months of last IP. So we to assess the Dhatu Samya, the health of the patient, we asked him to asked about the disease. So aim of the treatment was maintain Dhatu Samya homeostasis. For that purpose, what treatments we followed was we advised where following healthy regimen and lifestyle, pranayama, yoga, avoid pillow. These were the advised him to follow, and with some diets which are not vatakara. Result was able to walk 1 to 2 kilometers, do daily routines. So this was just with the lifestyle modification and diet. So 12 months he was good enough with daily routines and able to walk 1 to 2 kilometers. So with happily he sent a video to making video himself to us through the mail. So I will show you that one later on. Coming to the muscle power assessment, that is BT. BT is before treatment, means before treatment means first day of admission to our hospital. After treatment means after 7.5 months, means 229 days of all the treatments, OP, IP level treatments. So at the end, so that is going to tell you the muscle power of the patient. So to begin with, right side power, that is upper limb proximal. Before treatment was 1, after treatment it was 3. Right side lower limb proximal, second column. Before treatment it is 1, after treatment is 4. Right in pink color upper limb distal, before treatment was 3, after treatment was 4. Right lower limb distal, before treatment it was 2, after treatment it was 4. Hand grip at last column with orange, that is right, before treatment it was 1, after treatment it was 4. Left side, upper limb proximal, it was 3 before treatment, after it was 4. Lower limb proximal, left it was before treatment it was 2, after treatment it was 5. Left upper limb distal in pink, 3 before treatment, after treatment it was 4. Left lower limb distal, left 2 before treatment, after treatment it was 5. Hand grip in left, 2 before treatment, after it was 5. So total in the tape in the rectangle, we told that total duration of treatment was 7.5 months, that is 26 days first IP admission, next 21 OP treatment, next 21 days once again second admission, next 150 days OPD treatment, next 11 days IP treatment, total 229 days of treatment. So he was able to do his daily routines. Just to recall you, this is the these three videos are on the first day of admission on 23/3/2019. To begin with, that is legs, power in the legs, that is right and left leg, you can just see it, so you can just remember, try to remember. We will show the same thing in first video. Second videos, power in the hands, almost 1 in right and 3 in left upper limb. And coming to the third video, that is giddiness, he will show the like this with hands. He's and even also you can appreciate that he is going to fall to left. Giddiness, postural giddiness, 3 to 5 seconds. Next is at the end of second course of treatment on 2/6/2019, June 2nd. So almost 68 days of treatment, able to walk with support. Just see the video. He was able to walk with walker support. Next, second video is at the end of third course of treatment on 11 December 2019. Means almost 229 days of treatment, able to walk without support. So you can appreciate the video. That one in appreciate. He is able to walk without support. We asked him to follow a single line, means tandem walk. So he is able to do it. Third video is recent condition on what we asked from home only. He sent this one video, that is 4/11/2020 in this corona pandemic. After 1 year from last IP in his house, able to walk without support and do daily routines. So you can see the video. He is very healthy and very happy. Coming to the conclusion, a traumatic cervical myelopathy can be understood as marma abhighatasya Sarvanga roga. After first course of treatment, he got control over bowel and bladder, able to sit for few seconds. After second course of treatment, he was able to walk with support of walker. After third course of treatment, he was able to walk and do his daily routines independently. So, for a practice, so we have to day by day we have to assess the changes in the patients in regard to dosha, dhatu, malas, dosha and dusha vitiations. Accordingly we can plan the medicines or the procedures, chikitsas, treatment modalities changes, so that what we want is the improvement in the patients. So with this, our motto of such treatments are patient comes to us horizontally and goes vertically, means they will come on stretcher or walker, they will go by walking. Thank you. Kindly subscribe and write the feedback. Thank you.